Hi, welcome to my channel. I'm Nasim. I'm the registered physiotherapist and founder of OVA Women's Health Physiotherapy Clinic, a specialized pelvic health physiotherapy clinic in Burnaby, British Columbia, Canada. Now, if you don't know what pelvic floor physiotherapy is and how it can help you with your symptoms, this video is for you. So let's get started. Before we get into pelvic floor physiotherapy, you need to know a little bit about your pelvic floor muscles. These are the muscles that sit like a basket underneath the pelvic, at the bottom of your pelvic. The site of attachment of these muscles go from the pubic bone, the front, to the tailbone, the back, and from sit bone to sit bone. These are the muscles that support the organs within the pelvic region, the bladder, uterus, and the rectum. They support them and keep them in place. These are the muscles that help with stability of the joints within the pelvis. The pubic symphysis, the sacroiliac joint in the back, and the joints attachments from the top, which is the spine, and the hip bones on the side. These are the muscles that help keep us continent. They keep urethra and rectal opening closed and open, and they help with sexual function, blood circulation, and lymphatic flow as well. Now, what happens if the muscles are not functioning the way that they're supposed to? You will have symptoms that would indicate a dysfunction in these muscles. And that's what we are going to look into more with pelvic floor physiotherapy. Now, bear in mind that pelvic floor physiotherapy is not only about your pelvic floor muscles and the pelvic region. We want to have a global whole person approach to be able to identify what exactly is causing your symptoms. It could not be just coming from the pelvic region and the pelvic floor muscles, but it could be a factor somewhere else in the body that should be addressed. So when you come in for an assessment, you will have a thorough assessment from the entire body. Now, who can benefit from pelvic floor physiotherapy? If you're experiencing pain with intercourse, persistent pelvic pain, if you are not able to insert a tampon, a Diva cup, or you go for medical exams and it's extremely painful, if you're experiencing any heaviness in the pelvic region, or you've been told you have pelvic organ prolapse, if you are experiencing any pain with sexual activity, not only intercourse, you've been diagnosed with vulvodynia, vaginismus, and during pregnancy and postpartum, all of these conditions can be treated with pelvic floor physiotherapy. I hope this video gave you a general idea about pelvic health physiotherapy, pelvic floor muscles, their functions, and what symptoms to look for when you're reaching out to practitioners. But if you would like to know more about your pelvic health and how to self-manage your symptoms and your pelvic floor physiotherapy in general, make sure to subscribe to my channel. I will put a link to my website down below and leave us any questions or comments that you have. Thank you again for watching this video, and I'll see you soon.